Good afternoon. My name is Dr. Healing, and you are tuned in on Rehab with Dr. Healing. So, today I have 3 patients who are coming in to talk about their multiple disorder or illnesses that they've been dealing with for a long time. So please help me welcome Chanel, Michaela.
So, please tell me, how did you first know you were diagnosed with your illness or disorder, however you want me to term it? Starting with Michaela.
Well, my mom told me that I had a traumatic event happen to me when I was younger, but I don't remember it. And I was displaying symptoms of dissociative personality disorder, like I tried to commit suicide 2 times, I abused drugs, I'm depressed sometimes, and I turned into another person.
Who's this other person?
Joseph. Well, I don't know.
About you, Chanel.
Well, when I kept washing my hands and I just kept checking the doorknobs to make sure that they're locked before I went to work, it just slowed down my time and it just really messed up my lifestyle. And I kept coming to work like 2-3 hours late because I kept washing my hands. I had to take a shower at least 5 times before I went to work. So it really messed up my lifestyle, and my family took me to a doctor against my will, and they said I had obsessive compulsive disorder.
Shamari.
Well, I know I was always angry all the time. I wasn't okay with my self-image, and one time I had gotten into a fight with my mom because she was trying to calm me down. And I don't like when a person, tries to calm me down or try to control me. So I just attacked her, and I wouldn't let her go. My father came in the room, and he tried to, get me off her, and it wasn't working. So he called the police and everything. They came, and they struck me down. And after that, I went to the doctor. They ran some tests, and that's when they told me what I had.
So, my next question is, how does your family deal with your illnesses? Starting with you, Chanel.
Well, I really don't like going outside the house because there's so many germs everywhere. But my family doesn't come see me. I don't come see them. I missed my nephew's first birthday because I didn't want to kiss him or hug him or see him. So, I really don't see my family like that.
How does that make you feel not wanting to hug your nephew?
I feel like if I'm clean, then I'm fine.
Really? That's interesting. What about you, Shamari?
We distance ourselves from each other. Like, me and my mom, we're not around each other. We don't go around each other. And my other family members, since they found out, what I have, and they done research, they're scared that I might attack them. So I just don't go to any events, anything. I just pretty much stay to myself or try to.
So I just have another question concerning about your lifestyle, being that you have 2 other, different personalities. Are you currently dating anyone, and does that affect your relationship?
Relationships, they don't work for me. I had a boyfriend for a year, and he thought I was weird. It didn't work. And relationships just aren't for me. Joseph, he had a girlfriend for a little bit, but Joseph isn't around all the time, so it didn't last long.
That's interesting. So, are any of y'all currently seeking self-help or solutions as how to handle this in life?
Well, I'm going to group, therapy 3 times a week, and I have a therapist that I see, once a week, and it's it helps because when I talk about my problem, it really helps, calm me down or whatever, get out how I'm really feeling on the inside.
What about you, Chanel?
The doctor prescribed me some hormone or something like that to reduce my compulsiveness, and I'm supposed to be taking therapy, but I can't really go outside my house because there's so many germs, and I don't want to touch the doorknob or the car door or the steering wheel or the gas pedal. So the actual therapist has to come see me, but
So
she
you-
has to be strapped down. She has to be clean, everything, gloves, everything.
So you have like your own home nurse.
Yeah, home therapist.
Okay. What about you, Michelle?
Well, I take medication for my depression and suicidal tendencies. I go to AA meetings to reduce or stop drinking and doing drugs and stuff. I have a few phobias, but they can't really do anything about that. Anxiety, I take anxiety medication. And I see a psychiatrist once a week.
Well, I would just like to say thank you all for being on the show today. And I really can say I really wish the best of luck to you all. And I look forward to seeing you later on in the future, especially if you want to stay in my rehab or come put your little, just be there, be in my facility, and we can all help you out if your solutions are not helping. So, to conclude this message, I am Dr. Hewlin, and this has been Rehab. So,